So we have been partnering with the U.S. Army Corps of Engineers, the Philadelphia district, to do site visits and determine if there are viable sites that we can put these additional care facilities, and really try and partner with outside entities to be able to stand up these sites and take care of patients outside of the hospital. That way the hospitals can focus on the COVID-19 positive patients. It took a couple of weeks for us to really get to this point where we could stand up a site and staff the site. The steps were kind of involving getting the National Guard folks into the DEMA, working with the state agencies like DEMA and the Department of Public Health, determining what kind of sites we were looking for, the patient type that were going to be at these sites, and in what locations we wanted to. So initially, the first step was really to find locations that we could assess, and with the help of the U.S. Army Corps of Engineers and the Philadelphia district, they helped us assess sites, and they gave presentations on what they deemed a viable site, and then the state chooses a site that they want to participate in and to pursue. So we chose AI duPont. That was one of the sites that we looked at in the beginning. And once that was done, AI duPont, Nemours, with the help of Christiana Care as well, kind of worked as a team with the National Guard, with DEMA, with the Department of Public Health to push forward and open up a site as soon as possible. So I can't say enough about AI duPont, Nemours, and Christiana Care, and really what they've done to make this site possible. Right now it's a 38-bed site, and we're up and running. They have everything set up the way that they want it to. We have the staffing figured out, and now they're just doing training. So it really has transformed in just 3 weeks, which really, we didn't actually specifically pick the site, I don't think, until a week and a half ago. So for them to have transformed this location, and it's luckily they have such a giant campus here that they were able to make it so we could enter into a different entrance than regular pediatric patients, because obviously this is a pediatric hospital. They made it so that we had easy access to a separate area. These are non-COVID patients, but of course we want to separate the pediatric patients from the adult patients. And they're just an incredible partner with DEMA and Department of Public Health and the National Guard. And we're all just kind of working as one team to get this care site set up so that we can help decompress those main hospitals and hopefully help the citizens of Delaware as a whole. We reported to all the different units throughout the state and asked them to provide us with names of medical personnel and what they did in the civilian world, because A, we didn't want to pull from the civilian healthcare system, obviously, because that's kind of defeating the purpose. We wanted to take people who maybe don't work in the civilian healthcare system but have that skill set on the military side and bring that to these additional care sites. So we reached out to all the units. They reported back to us with who was available, and when we made the decision to select AI duPont and Nemours started to get the site up and ready, at some point they made a request through DEMA for a specific number of individuals, and they chose 16, and it's a mix, 8 of the Air Guard side and 8 of the Army Guard side. 16 individuals that are going to supplement the Christiana Care and Nemours population of healthcare providers to provide care for a 38-bed system. For a couple days, they plan on doing some orientation training, and they are getting put into the systems. They're getting badges to be able to access the building and the cafeteria area. They're doing some scenario-based training so that way they can kind of work. These individuals have never worked together before, and they're all from different backgrounds. So it's just a way to kind of integrate and make sure everyone's on the same page. We split them up into 4 different teams, and they have rotations for 12-hour shifts. And so they're just getting to know each other, trying to figure out where everyone is at skill set level, and just trying to figure out exactly how they're going to go forward as teams to really provide the best care possible. This is definitely an incredible experience. It's something I've never experienced before. I mean, I was part of aviation for 11 years. The last 5 years have been in the medevac unit, and I've definitely experienced a small subset of the medical world, and this is definitely a completely different aspect, and it's really just kind of a wonderful opportunity to be able to help the state of Delaware. I mean, we're all Delawareans at heart, even if we're from out of state, and we really just want to make sure that we can make an impact and help with this situation, and hopefully in time we can get a hold of it and we can go back to our normal lives.
That kind of stuff in the beginning, you know, the nurses figuring out what medics can do, you know, that's a big, that was an immediate question. too.
Well, no.
Make sure it don't go back in the background. Once you focus on it.
Saturday and then Sunday, because it goes down to the next one. Yep. And then you don't work, you work, you don't. It's going to be Thursday schedule, and you go Thursday for 100% dedicated to this, and it's pretty awesome to see. I've been on all their conference calls and they can assist. And they don't have to, because especially Nemours, the pediatric. Anything that you need. Okay? Yes, if there are by end of day they don't have access, anybody is welcome to come back tomorrow and finish it up. Make sure that we're still on Thursday, starting shifts and everything.
For the Guard, I have all of your access to give out to you so that you can try to log on. For folks that already have Epic access, I want you to get on and try to see if you can get into the... Where's Teresa? Teresa, nursing is a second career for you. What was your first career?
C and D.
Okay, still C and D.
Still C and D, yeah.
We're citizen soldiers, so we're part of the community, and some of us already have worked in the community, and it's just our presence helps alleviate the burden of just the hospitals trying to provide all the staffing to provide the care to the patients. Okay, so today is our first time of coming together. We're getting training on the computers, on how we're going to receive our patients, how we're going to utilize the computer documentation, starting IVs, how to use their equipment specific to this facility. And then tomorrow we'll continue that training, anything that wasn't finished today, and meet with our teams. And then Thursday is when we will actually start receiving patients. They already have some lined up to come over here. I think it's awesome. It's an honor to do my job. I always have felt that way. It's an honor to be a nurse and to care for others. Being flexible, because you never know what patients you're going to get. I do aeromedical evacuation, and a lot of times we don't even know what patients we're going to get when we land at our destination. So having that flexibility and being able to adapt to any situation is critical in this type of an environment.
The fact that, we don't want to put them at risk because it's all right. We do have procedures in place if they get symptomatic while they're...
There's like a whole class that goes around. Okay. We'll go down and then we'll read what's up. Okay. Do you want it turned off, ma'am? Yes, please.
This is your 600 milligrams in 50 ml. This is your recipe. Would never change.
Okay, so you just put a normal thing.
So we would just put a normal thing in syringe, push 2 or 3 ml for clear channel select. And that says to the pump, hi brain, I want to select this channel to work with. So next thing is drugs, IV, this gray piece right here, and then this clear piece. Everyone take the clear piece and pull it away from them. Kind of like, it's not the smoothest thing. Yep, just kind of get it out of your way. Kind of cool. And then you would also look at the bag and realize that it's in 100 mLs.
Patient wants to initiate, if you're a nurse, what you do at the end of your shift, you need to go into your directory.
All our friends and neighbors.
Hit the green button at the top, right? And then once you do that, you power down. Just hold down. Sorry, go into.
I'm actually a nursing director of perioperative services.
Good. Wow, that's fancy.
Fancy stuff, man.
This is before she put me to work.
Not going to diagnose. We all want that. But that may be your most general one. I don't know. That's like so you're just going to set that, and then what you're going to do is you're going to grab your scanner. That's all you have to do. You don't have to do anything else.
will be even doing them mostly. Well, you guys don't, unless you guys have trouble getting draw your rack, you're not going to have it flush. Put the cable on them, so if you need help with that. And we are on bolt, so you can just bolt us. You just have to tell us where you are. And we can tuck it short up. So, but for the most part, you're
out your head. That's why. Because somebody doesn't turn it off and it's that last number of ones are coming is my understanding. Okay. Then plug already for them. You just plug it back in and charge it back with
Texas room. There's your Solaris. Okay. And like if you open this, these have keys.
So all
but like this thing right here, which is almost
So we need a couple of volunteers. Give it 5, so you just have to. I don't even want to shut it off and restart it.
on a hook.
Oh, okay.
And that should come in a secondary bag, the hook for the primary. It itself is like 20, so they're only getting almost half what they want. This tubing also can be vented.
Yeah, when push comes to shove, what they really